welcome to Gracefully Graying. I'm your host, Attorney Henry Gornbein. Today on Gracefully Graying, I'm pleased to welcome as my guest Dr. Joel Young, the director of the Rochester Center for Behavioral Medicine. Joel, welcome to Gracefully Graying.
Well, thank you very much for inviting me.
First of all, why don't you tell us a little bit about the Rochester Center for Behavioral Medicine, which you are the director of, and how it's unique, for lack of a better word.
Yeah, well, thank you. So I'm a native Detroiter. I trained my medical training at the University of Michigan, and I came back in 1993 to start a practice in Rochester Hills, Michigan. And it's a psychiatric practice, which really started with me and has grown over the years. We now are about 70 strong. I think we're the largest private mental health facility in the state, a single site. And we are taking care of a lot of people. Typically, we would see them face to face. And more recently, we've been seeing them virtually. And our clinic is composed of psychiatrists, psychologists, social workers, all sorts of counselors, and patients are generally assigned a physician or physician assistant, nurse practitioner, and a therapist, somebody to help prescribe medicines if necessary, and someone to perform psychotherapy. And we've been working this model for many years.
What is the biopsychosocial approach? And if I mispronounced it, pardon me, but it's a mouthful.
You got it. The biopsychosocial approach is really the philosophy that we're quite committed to. Basically, what it says is that everyone that walks in our door is all those things. They are biological creatures. They have a physiology. They have a central nervous system. And I know as a physician, usually it's working well, and sometimes it's not working well. Sometimes people have biological conditions like anxiety, depression, psychosis, attention deficit, etc. So it's my job as a physician to understand what's healthy, but really what's not healthy. And that's the biology part of biopsychosocial. But we also know people have a psychology. They also have a way of looking at the world, a schema. And it's our job also to understand their psychological underpinnings. And finally, we all live in a society. We all live in Oakland County or Wayne County or the Upper Peninsula, or we identify with certain nationalities or religions. And that is the sociological part. So it's a holistic approach to understanding everybody in these various contexts. And I find it very helpful as a way of describing everyone's story.
Got a question for you. And I noticed in your resume that you are with Wayne State University, and that one of your passions is you want to encourage other physicians to go into the field of psychiatry. Tell us about that.
Yeah, well, that's an important part of what I do and what I believe in. I have taught for many years at the Wayne State University School of Medicine, which has really been the leader in producing physicians for Michigan, decades in, decades out. It's one of the largest medical schools in the country. And Wayne State produces all sorts of doctors, including psychiatrists, and it's always been my interest to try and get the next generation of psychiatrists and psychiatric nurse practitioners and physician's assistants and train them. Traditionally, Henry, psychiatry has been a field that has been underserved, and it's been hard to find psychiatric care. And part of that is there's been a shortage of psychiatric providers. So I've really been on a campaign along with a lot of other local psychiatrists to increase the supply of psychiatrists to address the access issue that's so relevant to all of mental health care.
Now, you started to allude to it, but let's go into a little more detail about the fact that your clinic takes a multidisciplinary approach. And tell our viewers a little bit more about that.
Well, we are committed to this multidisciplinary approach. Sometimes we call it the biopsychosocial approach. Sometimes we call it holistic medicine. In other words, somebody comes in to us in distress. Most people who come to see us are in some degree of distress, sometimes mild, sometimes quite severe. And we try and evaluate them appropriately. So if they need some counseling, if they're going through a rough time, if they're going through a job dislocation or a severe stress with regard to their family members, their children, they are at a crossroads when it comes to their marriage, we're there for them. We try and listen to them, be non-judgmental, but try and use our experience and maybe whatever wisdom we've accrued to help people as a neutral third party, just like maybe a mediator would in your profession. So it's important to give people good, honest feedback, and that's what counseling is at its best. Having said that, sometimes just counseling alone is insufficient. Sometimes a medical evaluation, a psychiatric evaluation is necessary. Sometimes psychotropic medications are necessary, and we have expertise in that. In my practice, we have about 13 of us who are prescribers, psychiatrists, nurse practitioners, physician assistants, and if necessary, we will use medications with patients' permission in conjunction with counseling. So we try and give everyone an honest assessment, give them good feedback, and let them decide what approach they'd like to proceed. No two people sometimes want the same thing, but it's our job to offer everything that's evidence-based and scientifically valid.
Joel, traditionally in your area, whether it's psychiatry, whether it's therapy, whether it's marriage counseling, the dynamics are your client/patient coming into an office, sometimes having therapy by lying on a couch, more often having therapy by sitting in a chair across from the therapist. Sometimes it's a group setting, sometimes it's a husband and wife. So you have all these sessions, but the module has always been in-person therapy. Then I was thinking back to, and we mentioned before we started, Lisa Kudrow and web therapy, which was a spoof, but now it's reality. So I don't know if you're doing any of the traditional therapy, but I know a lot of your therapy is now done, just as our show is being done, through Zoom or other remote techniques. So tell us about the impact of the coronavirus on your practice and what's been going on for the last at least 4 to 6 weeks.
Yeah, it's pretty fascinating because I think in some ways this is a transformational moment. As I mentioned, we have about 70 people in our practice, and in about 20,000 square feet. And on any given day, 3 months ago, it was a very busy place with people right on top of each other, and a very busy waiting room, and people walking up and down the corridors. In other words, just like in any other American medical practice. And then, of course, that changed very quickly. Now, fortunately, we have been piloting Zoom technology in the previous couple months. And as a result, we were prepared. So in early March, when it was pretty clear what was happening, I very quickly transformed my clinic, along with a great number of people in my practice. Virtually overnight, we became a virtual clinic. And fortunately, we understood Zoom. We immediately purchased about 30 more licenses from Zoom. And then basically within a couple of days, we were doing psychotherapy and medication review online. One of the interesting things is that insurance companies, for the first time, agreed that this was a good approach. Prior to that, virtual technology, or you mentioned Lisa Kudrow's funny series, I think that those were basically cash transactions. And now what has made this so transformative is that insurance companies are on board, the technology is there, and two more elements. patients really like this. They like the convenience of it. They love not having to drive to the doctor's office. They love not having to be in a waiting room, particularly for psychiatric purposes, because everyone's there confidentially and nobody wants to be in a waiting room unnecessarily. And what we've seen is people make their appointments, they stay with their appointments, they, even if they're ill or they have some type of mild infection, they're able to do their therapy. So I think everyone's finding it to be an efficient way of communicating.
How effective do you think it's? I mean, it's like, do you lose? Sometimes you're watching for tells, for body movements, for, things that, he or she is lying through their teeth. They're not telling you something. Can you catch all these nuances on Zoom that you can in person? That would be one of my questions, I guess.
Yes. So I think the answer is you lose something on some level. For instance, I was interviewing a new patient recently, and we were talking very intensively. And then it wasn't probably until about they had the same shot that I have a view right now, which is about shoulders up, and I didn't realize this individual was wheelchair confined. That really didn't have a lot to do exactly for the reason why they were there, but obviously it was an important part for me to understand. Had I wheeled them back from my wheelchair into my office, I would have really understood that as an element of their existence. So certain things do pass you by, but by and large, at least in my specialty of psychiatry, it seems to translate quite well, if not perfectly, from face-to-face to virtual.
Let's talk about the fact that many of us, whether we're in therapy or not, we're going through an unbelievable reality. It's like, this is terrifying. We've got a double whammy, for lack of a better word, of both a pandemic that is killing thousands and thousands of people. I was thinking about the fact of saying, well, it's already killed more people than in the entire Vietnam War, which lasted several years. You talk about statistics for our annual death rates for automobile accidents or other heart attacks, but those are over a year. We're talking about over 60,000 deaths now in a matter of 6 weeks, maybe 7 weeks. It's like terrifying. So what are you seeing with regard to your patients, and how are you dealing with the fact that whether we're in the more vulnerable stages, such as myself, or people of all ages, how do you deal with the fact that there's fear, there's depression? Let's talk about some of these issues, because this is really crucial to what you do.
Yeah. So this is an unbelievable moment. The epidemiology, the high rates of infectivity associated with COVID are quite remarkable. It's also becoming clear that certain parts of the population are more vulnerable. As been stated before, the elderly and people with pre-existing medical conditions are particularly at risk. But there's enough young people who are getting ill as well as to for us not to be cavalier that no one is really completely protected. So it's pretty clear who's at greater risk, but nobody is completely in the clear. Obviously, this is an insidious enemy, and it's the virus is ubiquitous. That's why we're masking, and it's in some ways hard to avoid. We get the sense that what we've done is flatten the curve, but we probably have prolonged it as well. And this probably won't go away, although the summer might show lower incidence. From a mental health perspective, what we're finding is people, particularly with a pre-existing predisposition towards anxiety, are finding this to be very difficult. It's the unknown. It's mysterious, and there's no foolproof way of protecting yourself. And I think it's particularly scary to people. I think people have retreated into their homes, and in some ways that's actually been helpful for some of our patients because that's their natural habitat, and So actually, paradoxically, in some people, we see less anxiety. In the next few weeks, we're going to venture back out. And I think that this is going to be anxiety provoking. People obviously want to return to their old world, but it's actually going to be the transition back into the world might be similar to going back to school in September. There are some people who are going to have a really hard time, and and then we've had people who've had depression, who've had grief and loss during this period of time. Even in our clinic, we've lost a dear member of our clinic, the parent of one of our RCBM family. So everyone's been touched, and whether you're going through a grieving stage, which is a normal stage, or a more profound depression, what we have here is a condition that is triggering a lot of people. And it's our job at the Rochester Center to be there and to be steady and to be helpful to our patients who are going through a tough time.
Joel, you're also dealing with loneliness because people are isolated more, and it's not as if you can reach out and touch someone, so to speak. And I'm also thinking that what you're doing with therapy through the web or through Zoom, you could actually be treating people who are in nursing homes or assisted living facilities, because if they have the capability with the technology, you could be helping a lot of people that perhaps you couldn't reach otherwise. And I was just thinking of that as we're talking.
Henry, thank you for raising that issue of loneliness. There is a very poignant British study within the last year or two showing loneliness, the factor of loneliness being a huge issue when it comes to mental health, particularly in the elderly, and very high rates of loneliness or perceived loneliness. And this is a huge issue. It's associated with a less good outcome with regard to health. And I agree with you completely that this technology, just putting a tablet in front of somebody at a prescribed time, having a therapist or a professional on the other end, friends are very helpful too, but sometimes you need a professional. This is a wonderful way of counteracting what is truly an epidemic, which is that of loneliness. It's cruel to be alone and not to feel connected and to be isolated. And any way that we can subvert that, technology seems to be a great way, particularly at people who are currently at risk for COVID. And that's really what's motivated us at the Rochester Center to make this move towards virtual technology. And it's been going very, very well. And have increasingly been reaching out to the older populations. And this is an initiative that particularly a subgroup of us at the clinic. I'm actually a geriatric psychiatrist, and I have a number of my colleagues who are interested in working with people in their 6th, 7th, and 8th decade of life and up. And we really want to be there for them. We view that as our role as a community servant.
Joel, one thing I noticed when I was looking at your website in preparation for this show is you emphasize 3 things: empathy, kindness, and wisdom. And I'm thinking, wow, those are 3 things that seem to be lacking so much in our current state of political and governing affairs. But why don't you expound a little on that topic for us?
Well, our job. Thank you. You're a lawyer, and by definition, the legal system is an adversarial system where there's 2 arguments generally. There are exceptions to that, but in medicine and psychiatry, we have a different model, and that is everyone's our patient. Everyone has to be viewed as a human being, vulnerabilities and strengths at all. So for everyone who's a victim of say, abuse, we will see that person, but we also might see the abuser. For every victim of a crime, we'll probably see the person who perpetrated the crime. For every Republican, we'll see a Democrat. And for every Zionist, we'll see a Palestinian. And that's just what we do. Our job is to try and have that therapeutic neutrality, and just to bring medicine and the tradition of healing to everybody. So we try not to be judgmental. I can't say we're perfect at that, but that's really an aspiration of ours. The wisdom, I think, does come from having gray hair, and I like the name of the website that you and Lori Bloom have given this really exciting new initiative, because I can say this to you and you can say it to me, but gray hair does mean something. It does mean they have a few years of experience, and you have a tendency not to fall into the same traps that you did a few decades ago. Probably make some other mistakes, but there is something about being around and having done this for a few decades that does give you a leg up.
We're very pleased to have you as part of the Gracefully Graying community, which, it's the whole idea that I came up with, to look at every aspect of who we are and what we do. And it's just medical, legal, economic, social, psychological, physical. And I'm in love with the concept. Lori's joined me, and we're so glad that you and your group have joined us. Let's shift forward. They're talking about starting to move into some type of new normal. I don't know what that's going to be, but do you see in the coming weeks and months going back to seeing patients, clients in the traditional office setting, or do you see more and more that what we're doing now through Zoom, whether it's Zoom video, Zoom therapy, or other means through technology, becoming the norm rather than the exception?
Yes, I think the greatest gift we would get is if we wake up tomorrow and an objective news outlet, let's say the BBC, says we have a vaccine or we have a very legitimate therapeutic. There would be celebration in the street. I think of the end of World War II. I think we'd have our own celebration. I doubt we're going to get that discrete news that there's been victory immediately, but eventually it will come. But let's assume this day is tomorrow, and we are able to, there is a vaccine that's widely available, that works, that's safe. I think American society has been changed, and I certainly can speak for the Rochester Center for Behavioral Medicine. We are changed. We were a clinic that was seeing over 300 people a day, face to face. That was very meaningful to have that transaction, to be able to bump fists, to be able to pat somebody on the back, to be able to have human interaction, to connect, to smile. That was very important. And I think we will have some of that back. But I think for us, at least, speaking for this organization that I put my heart and soul into, we will definitely be, at least in part, a virtual clinic going forward. And I think there's a lot of benefits to that. I think that we'll be able to access people from Monroe to Marquette, because we are a Michigan practice. And trust me, there is not very many psychiatrists north of Flint, Michigan. And now we'll be able to go into Imlay City, and we'll be able to go into Traverse City, and we'll be able to go into East Tawas and Manistee. So I think that that's going to be good. And I don't think we're ever going back from that.
Think of it, you could continue to see those of your patients who are snowbirds continue therapy while they're perhaps in Florida or Arizona for the winter. I don't know. It just popped into my mind as we're talking.
Well, Henry, if that's the case, we're going to need people in your field, because I think the one thing that we're going to encounter is doctors crossing state lines. We're all licensed within the state. So there is a movement right now, particularly for snowbirds and people who do go to Arizona or California or Texas. They want to be able to maintain their physician relationship with their doctor back in Michigan. This is a huge issue, not so much in Florida where there's a lot of reciprocal relationships, but sometimes if people go to California, maybe parts of Texas, they have very strong state laws, and it's very hard for snowbirds to maintain their relation with their doctor at home. This should change, and it's going to need doctors and lawyers and legislators to get that done.
Joel, are there any antidotes that you want to discuss before we sign up, where you've got like 2.5 minutes left with regard to, the key features that we mentioned earlier? There's so much depression, there's so much loss, the fact that, if you have a loved one die, you can't have grieving. You can't go to a visitation at a funeral home. You can't have Shiva if you're Jewish. So there's so many things that have changed. And what are some antidotes that you can suggest before we sign off?
Well, it is true. All these important customs and rituals are changing, and they're changing very quickly. And yet we are adapting, and we are an incredibly adaptive society. Perhaps what's allowing us to adapt most readily is the internet. It is just this incredibly powerful vehicle, which we really did not have less than a generation ago, and it's more sophisticated now than it was 5 years ago. So religious services are going online, and even memorial services are going online. Birthday parties are online. It's different, but it is within the realm of normal. And I think we have to really go forth with optimism and faith that we will adapt to this temporary new circumstance in our life. And although it's nice to go to a Shiva and break bread with somebody, now we can have Shiva and have people from California come in as well. So for who otherwise wouldn't, now they can come in virtually. So for every downside, there's an upside. I think we have to be adaptive and optimistic. I do want to say that as committed as I am to the mental health of people of Michigan, even more fundamental is food insecurity. And our clinic has made a concerted effort to support the food banks, the Gleaners, Heart to Heart, and Yad Ezra, because fundamental to any health is food insecurity. And I really think they are incredibly important frontline workers as well. We all have to think about feeding people. That's maybe the most fundamental of all basic needs.
Dr. Joel Young, we're out of time. I want to thank you so much for being my guest on Gracefully Graying. This is phenomenal. We're in our respective homes, and I want to thank you for watching this episode of Gracefully Graying.